Talking about the psychiatric illnesses that are prevalent in the childhood and as well as the adolescent age group, it's very important that we consider the behavioral disorders in the children primarily over here. So, this is basically the major chunk of the psychiatric illnesses that is observed in this age group over here. There are a lot of conduct disorders that are usually seen, then there are specific kind of behaviors that are usually observed in this age group. What are the causes to this disorders? Basically, they are usually due to the environment that the child has been exposed to. Then there are a lot of attachment disorders that are again of the emotional kind. Basically, when we are talking about the behavioral disorders, there's another terminology which is known as the emotional disorders. They are interlinked. The causes, again, they are interlinked. So the risk factors, they are also interlinking in between these emotional as well as the behavioral disorders. We have the attention deficit hyperactivity syndromes, and then we have the autistic spectrum disorders. When we talk about these syndromes, they basically display a particular kind of behavior. So again, we have to focus on this fact, whether it is a syndrome which is belonging towards a particular criteria, whether it is fulfilling that criteria of ADHD or autism or not. There is a particular criteria in the DSM-4 and the ICD-10 classification. Whenever we are basically diagnosing a person as ADHD or an autistic child. So over here in this section, we'll be focusing on the oppositional defiance disorders. These are a group of disorders that are commonly seen in the children of this age group, that is almost 5 to 10. And then we have the conduct disorders that is again commonly seen in the school-going age group. So usually these children would show an aggressive behavior, but they can also show a depressive kind of behavior as well in some of the rare cases. Then we have the treatment that is encompassing this conduct and the behavioral disorders. And then we have the exceptions as well. One should keep in mind that a particular kind of a behavior, if it is age-related or age-appropriate, it should not be considered to be abnormal. Sometimes, for example, the temper tantrums that are usually seen at 3, they're quite common. But temper tantrums at the age of 10, they can be considered to be abnormal. So all of these phenomena should be kept in mind whenever we are categorizing a child to have a conduct disorder. So the behavioral problems, they are unable to comply with the adult requests. So usually the parents would come up with the complaints of the request denials, school refusals. All of these phenomena are usually seen in these children. Then we have the temper tantrums that are, if they are age-related, we would not categorize them as to be abnormal. Defined as willful, aggressive, and a defiant behavior again. So this is the terminology, this is the criteria in which we are categorizing them. The behavior should be willful, it should be of an aggressive kind, and it should be defiant as well. 2 to 4 years of age, knows about self but is not dependent. So this is the criteria that one should keep in mind. This is basically the age group in which the child basically gets to know himself or herself, but still he is a dependent. Then we have the oppositional defiance disorders over here. Toddlers up to the age group of 10, they are again considered to be more prone to this development of this oppositional defiance disorder. It is an aggressive disorder, and usually the child has temper tantrums more often. So the temper tantrums are not going to be age-related, they're going to be frequent, and the people surrounding these children are going to be affected due to their aggressive behavior over here. So it extends beyond the family into the school, and the problems in learning and peer relationships are also seen in such individuals. Then we have the conduct disorders. They're usually seen above 10 years of age, and then they're included in the ICD and the DSM classification. So ICD-10 and DSM-4 classification, we usually see these kind of these kind of conduct disorders. Then we have the socialized and the unsocialized type that is usually seen. We have the unsocialized group, which is going to be more problematic for the child, and the quality of life of that child is going to be affected through this unsocializing behavior as well. Adverse life events are usually going to result into such kind of conduct disorders. Risk factors that we should consider when we are treating these children with the conduct disorders: the parents who lack confidence. So the environmental factors, the genetic factors, they're going to play their role whenever we are discussing such kind of conduct disorders over here. Parents who received indifferent parenting, conflicting expectations by different adults, family conflicts, child temperament, comorbidity with neurodevelopmental disorders, learning disabilities is another criteria that should be kept in mind that can result in these particular kind of conduct disorders over here. A normal child temperament, and then the family environment. If there is a lot of conflict between the individuals of the family and the adults of the family, then the child is again going to show an aggressive behavior, and this willful aggressive behavior is going to result in these sorts of conduct disorders. Child abuse, collateral history again is very important over here to take, just to know what kind of a childhood the kid has been through. Organic problems, they are also going to result in these kind of conduct disorders. Management basically encompasses and frequently being carried out in institutes or within the community-based programs. So the awareness is very important. You get to know the parents, you make them aware of the condition, and then you start treating the patient. Often unsuccessful with 70 to 80% of the recidivism. So these are the phenomena that we should consider while we are treating these patients in general. The behavioral therapy that usually consists of the cognitive behavioral therapy, the anger management, stress management, social skills training, special education programming, parent management training. Again, as I've already emphasized on the fact that getting the parents aware of the condition is the primary goal over here whenever you're starting to manage such a case. The functional family therapy, you're going to make the environment more child friendly for that particular patient. The multi-systemic therapy, integrated approach by the family teachers, and the management of the coexisting problems. Medications in case of the coexisting problems, they're again very important when we are discussing this attention deficit hyperactivity syndrome over here. So the exceptions that we should consider while we are treating these patients should be the neurodevelopmental disorders. They should be excluded first of all when you start the treatment, because that is going to raise the expectation level. First of all, if you don't know that the child is suffering from some sort of a neurodevelopmental disorder, the expectations of the parents would be different and the expectations of the clinician would be different. Oppositional defiant disorders should be excluded as well. And then the older the child, it's hard basically to get the particular kind of a behavior changed or molded in a more appropriate manner. So one should keep in mind the age of the child, and then we should also include the neurodevelopmental disorders and as well as the oppositional defiant disorders. Defining the roles such as the naughty one. So it's again very important. You should make the parents aware of this fact that using such terminologies, the naughty one or some other terminologies that can be more notorious, they should be avoided at most. So in this section, basically, we dealt with these particular kind of conduct disorders that the child can have. So that is the end of this section. Thank you for watching sqadia.com.